Hi, my name is Linda Okafor, and in this Unit 10 journal, we talk about reflective practice. Reflective practice is an incredibly valuable tool for anyone in a healthcare profession, especially for those in the mental health field, like the Psychiatric Mental Health Nurse Practitioner program. Reflecting on the journey so far allows me to articulate and understand the progression of my own learning, the evolution of my professional identity, and the impact of my experience on my professional and personal development. Some of the goals that I set at the beginning were around acquiring specific clinical skills, developing a deeper understanding of psychiatric disorders, improving therapeutic communication, and perhaps engaging more with evidence based practice because this field is very new to me. Reflecting on the above goals, I made some adjustments based on the feedback received from my instructors and preceptors, and I assessed my confidence and competence to ensure that I am meeting these goals. Meeting these goals brought some sense of accomplishment and readiness for the challenges ahead. Experiencing and managing prejudice, biases, and feelings. During the clinical experiences, confronting prejudices and biases, whether they are related to mental health stigma, cultural misunderstandings, or personal predispositions, is inevitable. Acknowledging this feeling is the first step. Managing them often requires active reflection. Seeking education on cultures and conditions misunderstood and engaging in open dialogue with preceptors, instructors, and peers helped a lot. Understanding my biases significantly improved the therapeutic relationship and the quality of care I provided. I had an experience I later identified as countertransference. I was going through a challenging time in my relationship, and a patient came in and talked about her parents' relationship and how it destroyed her childhood. I became irritated because she chose to be friends with the parent that left the house and angry at the one that stayed. Another one is managing anxiety, self doubt, and uncertainties. I experienced some anxiety and self doubt, which stemmed from the pressure to perform and the fear of making mistakes. Strategies I use to manage these feelings include regular debriefing sections with preceptors, peer groups, and mindfulness practices and self care activities. Acknowledging that uncertainty is a part of clinical practice and that it diminishes with experience and continued learning also alleviated these feelings. Insight developed during clinical experience. Clinical experiences often offer profound insights into the human condition, the complexity of mental health care, and the intricacies of therapeutic relationships. I gained a deeper appreciation for the role of empathy, the importance of evidence based practice, and the need for self awareness and reflective practice in providing compassionate care. Sometimes I felt overwhelmed by the weight of the traumatic experiences some of the patients I encounter carry on a daily basis. Impact of reflective practice. Reflective practice can profoundly impact students personally, academically, and professionally. It fosters a growth mindset, encourages continuous learning, and aids in developing emotional resilience. Reflecting on my experiences allowed me to integrate theory with practice, recognize their strengths and weaknesses, and develop a personal philosophy of care. Future use of reflection in practice. Continuing to use reflection in future practice is essential for ongoing professional development and personal well being. It can help in maintaining a high standard of care, adapting to new challenges, and fostering lifelong journey of learning. Future reflection might involve structured reflective journal, participation in reflective discussion with colleagues, or engaging in formal supervision or mentoring relationships. Incorporating reflective practice into one's routine can enhance self awareness, empathy, and resilience, ultimately leading to more effective and compassionate care for patients. It is a cornerstone for professional development in the complex and ever changing field of mental health. Thank you very much.